On behalf of EASL, we welcome you to the best of the Nurses and Associates Forum 2017. So Catherine, really nice to have some time to reflect on the Nursing Forum today. How was it for you?
It was great. I see that the quality in the nurses and interests and what nurses are doing are in a very high level. We heard about different topics, most different in direct practical nursing and in developing for countries and new ideas.
What were the most exciting developments that you've seen today at the Nurses Forum?
That's very difficult to give only one answer in 7 beautiful speeches. So, but let me start just with the first. The first talking was understanding the integral role of public health for nursing care in hepatology. That was from United Kingdom. Joanne Busquet had a wonderful talk and explained how they are with the graduating. They had it with the goals and the aims and where they are standing just at the moment.
For Public Health England.
Yes.
Yeah, I quite liked Joanne's talk as well. She raised a really important point about the literacy level of our patients and how we need to take that into consideration. She reminded us that 1 in 6 people have the same literacy level as a 6-year-old child. And this was something that I have to say I haven't been thinking about in my practice as a nurse specialist. And it just reminded me that we have to make the patient education understandable and sometimes very basic and very simple for patients to adhere to treatment regimes or to motivate themselves to make the lifestyle changes. So that, for me, that was a key point from Joanna. Was there anything else from Joanna that you liked, Catherine?
I noted for myself the self-care continuum that goes over back to the patients and not still by the nurses and physicians. It was mostly overtaken in our further profession understanding.
Yes, we're giving the power back to the patient.
Yeah.
We're going to empower the patient.
That's not only in liver disease, that's also
In all specialities.
All specialties, yes. The next presentation was from Françoise Charnet-Sonnec from France. She got the title Specialist Nurses in Europe, Where Do We Stand? And her overview starts with an example, with a patient example. The patient was talking to her, and she introduced us to ESNO. That means a European-leveled organization, and she really brings our profession forward in an international way.
Okay. She talked a lot about trying to unify nurse specialists in Europe and for us to have some consistent educational requirements and for us to start practicing in similar ways, for us to become more of a group and have a stronger voice in the European community. She talked about the importance of nurse specialists ensuring quality and safety of the advanced care that we provide. And yes, that's a very good point, but I raised this concern myself that we are taking on more and more roles as nurse specialists. We're doing things that medics did a long time ago. We're also potentially overfilling our job plans, and I feel it's very important that nurse specialists have the infrastructure, the support and the infrastructure that we need to take on these roles, like good admin support, data managers, databases. It's very difficult for us to find time to research and audit our practice. We want to, but actually the European Specialist Nurse Association need to take this into consideration when lobbying for us, that actually to achieve everything that they want us to achieve, there has to be an infrastructure to support us with the data managers and the admin team.
And she mentioned as well that their recognition all over is very bad for that we are doing and saving in health care.
The next talk was by yourself, Catherine.
Yes.
It was titled Supporting Lifestyle Change Through Nurse-Led Motivation. And I must say it was a very thought-provoking talk, and speaking to a lot of nurses afterwards, people discussed how you brought us back to the basics of nursing, and reminded us of Maslow's hierarchy of needs of patients. You reminded us of the importance of ego, of patients' ego, and without addressing our needs and our ego, it's very, very hard to ask them to make the changes required, such as losing weight, exercising to prevent fatty liver disease. You talked about a contract with a patient, a motivation contract, as opposed to a holistic needs assessment to address the weight issues and the obesity. Could you just talk to us a little bit more about that?
Yes, you told me that you are interested about the contract, but it is really true. If we don't go to the deep ego of a patient, we can't have lifelong changes. There will be and stay only as a diet or something like that, but never a lifestyle change. And so we really have to go deep. And if we go deep, we have their wishes, dreams and needings, but no hardware. So we must go for a contract between the patient and what will bring him the best success, but with his mind and with his thoughts and with his values.
I quote, you said, to the root of the will of the patient.
Yes.
Very, very, very deep words. But I think anybody working with the Nurseled group of patients today was inspired by this talk. And I know that lots of people are already talking about setting contracts up with their patients to ensure long-term good outcomes, but a sustained lifestyle change. And I think that the contract certainly will help that. And the next talk was
about bringing new technologies in patients' care. Smartphone for OLT patients. The speaker was Thomas Brerd from France.
I just had one point about his talk. For me, he talked about this recurring problem that we don't have enough time in busy clinics. Our clinics are increasingly overbooked. Certainly for us in the UK, resources are difficult. We're in a very difficult financial climate in the NHS, and the consultations are getting shorter and shorter. So for me, this smartphone application was an important way of carrying on the education of the patient once they left the clinic. So on the app, they had all the information about their disease, their treatment, and they could read all of this once they left and go into the frequently answered questions section. So for me, that's how it would be relevant in the UK. What were your thoughts, Catherine?
In our forum was subtitled in multidisciplinary hepatology, what is the role of nurses and associated? And I think we are here on a very important point as well, because we have to handle over much more responsibilities to the patient. And so with this smartphone idea, we are there again. But under a lead. And that, I think, it's very important. And also very good for the patient. It will help for him. But he told us as well that the smartphone is not yet so well made that everyone can use it. It's complicated, still complicated, and they are on developing. That's great, but I think such solutions will come more and more.
Yeah, I mean, it's not for everybody.
No.
Like you say, there are people who will find it difficult to use, and you know, they are expensive. I'm not entirely sure who would fund all of them. But you know, we're in harsh financial times, certainly in the UK. But I think, you know, an alternative to smartphone is email clinic. I think it would be nice for, you know, patients to have the opportunity to email questions or photographs of problems like a rash related to a drug. So maybe the smartphone is not for all liver patients, but actually everybody, most people can manage to do an email, and it's easier for them to do an email. So I just think we need to be thinking about more electronic options to support patients.
It will spare nurses.
It will spare nurses. And next?
Multidisciplinary HCV clinics in the DAAS area, where are the key roles for nurses and associates. Speaker was Curtis Cooper.
So Curtis was our only physician speaker today at the Nursing Forum, and he'd come the whole way from Canada to give a very nice talk. What I thought was special about his talk was he, time and time again, kept referring to the value of a nurse in giving these direct-acting antiviral drugs. There has been some concern in the UK that due to the nursing, or the shortage of nurse specialists, and due to financial cuts, that, you know, physicians' assistants and technicians might be able to help with giving these drugs, and certainly the viral hepatitis colleagues of mine are, you know, feel very strongly that they should be given by nurse specialists with hepatology backgrounds. So you're using it as an opportunity not just to give a drug, but to actually motivate them to put a contract in place, to address all the other aspects of their life, the social aspects. That, you know, we know that liver patients have lots of psychosocial issues, and, you know, they can address all the needs of the patient in addition to giving the DAAs, and we can care for them. So we're very, and I think Curtis agreed. He felt that perhaps the way forward is a combination of technicians, of physicians' assistants, but always a nurse specialist to be involved. And that was his message throughout the talk. It was a very strong message.
The next was enhancing skills of nurses in hepatology. The example of transient elastography and paracentesis. Speaker was Marianne Beimolen.
Okay. Yeah, I was quite excited to hear that she obviously does the she does the paracentesis herself. She set up a really good paracentesis service. She's doing the elastography and the fibre scans, but she mentioned she's contemplating doing liver biopsies in the future. So I thought that was absolutely fantastic to see such advancement, that you know, liver specialist nurses are now going to be trained on how to do background liver biopsies, and also she wants to have a big part to play in the alpha pump management for patients with refractory ascites.
I think they planted the first alpha pump in someone there in their hospital.
Okay, but major advancement of the role, and shows the potential.
But she told us as well that she would like to train more nurses, and there we are. More nurses in specialties. We have not enough nurses at the moment, and that the gap will be bigger in the future.
And the last talk?
The last talk is Sorafenib, Nurseled, Clinic for Patients with HCC, Impact on Outcomes. That was for you, Pam.
It was.
You were the speaker.
And it well, for me, for liver nurse specialists out there, it was exciting to see how a nurse specialist can change the outcome from giving a very difficult drug to patients with liver cancer. Sorafenib is the only proven treatment that we have for advanced liver cancer, but it has a fairly significant toxicity profile.
But tell me a bit more about, you controlled yourself, and to bring the quality of your service high, you made very much of self-control and reflected the data. But you have put in several lists. May you tell me something about that?
Which lists?
The lists where you put in the values of blood and then how much of the treatment they have taken in.
So we were doing so badly at our trust with giving sorafenib that we decided to get the nurse specialist, which was myself, to see the patients more regularly, to educate them more, to empower them more, to monitor them more, to give them email contact with myself so that we could dose reduce quickly before the side effect became too severe, but most importantly that we could re-escalate once things settled, so that we were always trying to get a maximum dose into them. And it was very difficult data to capture because the dosing was fluctuating, every 2-3 days, up, down. But I had the help of a data manager in our office who set up a database for me, and it was by entering the number of tablets not taking every time the patient came back to clinic, he was able to calculate the actual dosing, because he also had the recommended daily dose to start with. So. Yes, it was a good audit to do. It showed an improvement in the duration on treatment. It showed better dosing for the patients, and most importantly, it showed a better overall survival than the UK audit. But I must point out as well that that our follow-up period is only 8 months. We're due to redo the survival curve again in the summer. But some really important points that actually if you give these patients the support and educate them and see them regularly, they will tolerate the drug a lot longer.
But I would point out furthermore that you were personally very much engaged in this case.
Yes, it took up a lot of my time.
Mail address and call address, your call number, and you were ready every time for the patient. But you had to train then a replacement for holiday times?
Well, I was lucky enough that I had the neuroendocrine nurse specialists who are very familiar with giving tyrosine kinase inhibitors, because they give sunitinib for neuroendocrine cancer, which has a similar toxicity profile to sorafenib. So I was lucky in that they were able to carry that care on when I was away. But I think the audit is just a really good example of how nurse specialists can do these things really well. But it's also important to say that we need resources to work at that level. I would argue that we need data managers, we need the admin support. None of this is possible without those things, because our day-to-day life is very busy.
But that's not all. We have always to have our lines. And for that we must know in all these cases was never declared that we don't need the physicians anymore. That's a teamwork.
Yeah, I mean, I ran the sorafenib clinic in the joint liver cancer clinic, so I had input from hepatologists and oncologists as and when I needed it. Yes, you're right, HCC and hepatology is a multidisciplinary profession.
Yes,
okay.
That was...
and I think that was all the talks.
Pam, what is the take-home message for you from this year, EASL here from Amsterdam?
Well, it's been a fantastic conference, both the scientific program and the nursing program. But it's been very obvious that there are a lot of positive trials and positive looking trials that will be later reported in ASCO 2017. There are so many new drugs coming through, both for hepatology, such as the hepatitis C virus drugs, and especially for hepatocellular carcinoma. everything is changing rapidly. Hepatology is an active area of research, and there is huge change, and I think this has big implications for us as nurse specialists. It raises new challenges, more education needs. It's a wonderful opportunity, but we as a group have to decide what are our priorities. What do we need to focus on? What is the most important aspect of these services for nurses? And I think that's my message.
My message, I will underline that if we so much changes in this in the area of hepatology, we really have to be up to date, and that we get very fast in a wonderful atmosphere here in Isel.
Okay.
And thank you very much for attending.
And just to remind everybody that all the presentations will be available on the Isel website, so we encourage you to visit the liver tree and refer to these presentations if needed. And thank you.